Obagi. I'd like to share with you the science of skin health during this time of the coronavirus crisis. There's nothing better than to reach all of you and tell you that we are going to pass through this and we are going to start all over again with more strength and more determination to help our patients. The science of skin health, the philosophy, the principles, and the clinical application will be discussed in this webinar. You will see that it is important for us to upgrade our knowledge because the current treatment focuses only on skin surface and symptoms. We need to go beyond that because such focus will be limiting our ability to improve our patients and to give them a successful result and reduce complication. So to think outside the box, we need to really address the skin as a living organ. Think if you are a tailor and you want to make a wonderful dress or a wonderful suit, you need a good material. You need a fresh cloth that you can use. This is our job as dermatologists, skin professional, plastic surgeon, is to make the skin look as new as possible. So the principles of skin health will enable you to renew skin and will enable you to eliminate varieties of problems because this problem doesn't drop on the skin from the sky. Usually it is due to abnormal cellular function, leading to varieties of problems, such as sensitivity, sebaceous gland disorders, pigmentation problem, DNA, sun damage, and aging. So we need to expand our focus beyond the surface and go to restore normal cellular function in the skin. When I started my dermatology residency, I really was frustrated because of many things. The available treatment was really limited. And there is no explanation at that time was given why the response to treatment can be variable. Some patients improve more than others. Some don't improve at all using the same topical treatment. And for that, we really needed to change our thinking. Especially we have so many different skin types that was not addressed before. Due to this practice limitation, I started my search and work. We learned from our dermatology that our patients usually come to us trying to solve a problem or to treat a disease. Those patients who have no disease, they don't come to us. And we used to consider them people with normal skin. And if you look at that normal skin phenomena or that we observe all of us, maybe now knowing the principles of skin health will show you that there is many problems that were not addressed before. Women usually used skincare products to be more attractive, and many conditions that such as like large pores, excessive oiliness of the skin, roughness was really not addressed properly or understood properly. So, if we look at people with normal skin and we see abnormality in that skin, how can that skin be normal? So, the terms for a skin that's supposed to be ideal is perfect, ideal, beautiful, great, young, flawless, and so forth. But none of that description will address really ideal skin. We need to have a more definition. And the best way, the best thing that make you imagine the right thing is the baby skin. So baby skin can be the ideal skin, can be also a model for what we call healthy skin. By recognizing that, I started to work on creating the definition of healthy skin. Through research, I was able to come up with a definition of healthy skin. Skin that is naturally smooth. You will see that each item or each attribute is addressed properly as we go along. Skin is naturally strong, tolerant, hydrated, has even color tone, firm and tight, has a normal contour, and usually free of disease. These are the attributes of skin health definition. So if we talked about smooth, tolerant, hydrated, what we need to restore those elements or any of those attributes if it was missing. The way to do that will be by renewing the epidermis. To renew the epidermis, there is 3 little steps to follow. Prepare the skin surface by cleansing and getting the skin ready, cleanser, exfoliate, tone. Then to regulate the natural exfoliation, because when dead cells accumulate, skin becomes dull, and we need to enhance epidermal renewal by eliminating as much of the dead cells as possible. And then to address the barrier function, which to make skin strong and tolerant. So principle number 1, epidermal renewal. Epidermal renewal can help varieties of problems, such as, for example, early acne. Here you see a patient with many comedones. When we eliminate the trapped oil and clean the pores and renew the surface, you can see the process of restoration for a normal looking epidermis. Same thing, here is another patient with the same condition after epidermal renewal. So washing, exfoliating, and toning are really important steps to restore a natural healthy epidermis. The second principles that address the even color tone, it means we are really have to control melanocyte activity and action. So we are going to discuss this later in more details. To control the pigment, we have to restore even color tone, mean restoring the horizontal distribution of melanin. By doing, 2 steps. Step 1, to reduce the load of melanin in the epidermis by a process called bleaching. You can use hydroquinone, non-hydroquinone, you can use also vitamin C 10%. And by a process we call blending. That's when you mix hydroquinone with retinoic acid or retinol, or non-hydroquinone with retinoic acid and retinol. Blending does not bleach. It distributes melanin or melanin deposit evenly in the epidermis to restore even color tone. Bleaching reduces the amount of melanin in the epidermis. Here is another example of severe melasma. We are going to discuss this later in more detail. You can see by addressing the bleaching alone will reduce the intensity of the spots. But by restoring even color tone, you eliminate the spots, as you can see in this patient. To keep skin firm and tight indicate that we have to keep skin young. We age by losing collagen and elastin. So by restoring collagen and elastin, we can restore more useful looking skin and normal tightness and no laxity, no wrinkles, no lines. And this process is done through dermal and epidermal stimulation. By stimulation mean I am restoring the activity to the cells to produce collagen and elastin. Stimulation in ZO can be done in a mild way, where aging changes are minimal and just started, by using, for example, growth factor serum. But if we have more advanced aging changes, we may need something stronger. We call that strong stimulation. And that's done by using retinoic acid and proper concentration and formulation of retinol. Here we have an early aging changes where you see a little bit large pores, some wrinkles around the eye, little bit loose skin, and even color tone, dullness. So by doing the principles as we just discussed, review the epidermis and stimulate the dermis using ZO product, you can see that within 2 to 3 months, you can create a useful, wonderful looking skin and provide tremendous improvement. The normal contour can be restored by volume replacement using fillers or fat, etc. We can prevent contour loss by stimulating skin at early age. But once we lost the volume completely, we really have to go in and use artificial mean by injections. Skin should be free of a disease. Here, ZO is unique because I have created a wonderful protocol to address varieties of skin problems through simple, easy steps to follow. And also I will be discussing certain innovations in procedures that can be used to help us to renew the epidermis and stimulate the dermis and correct damaged texture. So how do we use these principles? It's quite common for a person in your clinic or a woman in general to tell you, I have sensitive skin and I have dry skin. This is one of the most common complaints we face. Really, this is not, should be a condition that's so difficult to treat. I don't think there is such a thing called naturally sensitive skin, because skin with a strong barrier function is supposed to tolerate everything. However, what causes the skin to be sensitive? It can be a genetic factor, atopic dermatitis, or inflicted on the skin, such as what we call contact dermatitis. These can be treated and eliminated. However, most of sensitivity of the skin comes as an acquired way, where we use moisturizers, wrong skin products, chronic inflammation that damage the barrier function, sun exposure, and so on. The majority of our patients complain, usually the sensitivity is acquired. The genetic one cannot be cured, can be treated, but the acquired one can be eliminated completely and prevented from coming back. So, in short, sensitivity means the barrier function is either weak or is lost. So the patient becomes intolerant to our treatment and may have a lot of patients with poor compliance. To overcome that will help you with your skin condition, you really have to eliminate skin sensitivity first. The dryness is the loss of ability of skin to trap water because we lose with age the substance called glycosaminoglycan, GAG. When we lose this substance, Skin loses ability to trap water and release it through 24 hours a day up to the epidermis. And that will be cause what we know scientifically increased transepidermal water loss. So when the skin is sensitive or dry, renew the epidermis, but eliminate sensitivity by restoring the barrier function. So step one, to improve skin quality and renew the epidermis, you should do that before performing or providing necessary treatment. When the patient has sensitive skin that will lead to poor compliance with any treatment necessary for their condition, we must eliminate sensitivity first and then address the disease properly. One of the most common problems we face in our practice are related to sebaceous glands. Acne, rosacea, seborrhea, folliculitis, excessive oiliness of the skin with large pores, sebaceous gland hyperplasty or adenomas. So these are really quite common. And we have advanced many a treatment protocol in Zio for this condition. In my research, the most common causing factor to all the problems induced by sebaceous gland is sebum. Originally, sebum was supposed to be a waterproofing agent to cover the fur that makes it like an excellent water repellent. But their purpose of sebaceous gland is really very ambiguous and not very clear. Because sebum, as we learned now, as I discovered in my research and work, can be immunogenic. And that explains why some people have acne and some people don't have acne. When you have acne, then maybe you have what we call focal immune response. And also sebum, when it's trapped in the skin, it creates a chronic inflammation through months and years. And that's why you see when you have trapped oil inside your pores, comedone, cysts, damaged texture, scars, and so forth. Knowing that sebum is immunogenic, so we have to, when we treat acne, we really have to reduce sebum to maximum. And that can be done by using certain topical agents, as we mentioned in epidermal renewal, and also by using certain devices and injectable to suppress the local immune response. The way I do it is that I recommend that wash, scrub, oil control, renew the epidermis by enhancing natural skin exfoliation, stimulate skin, create acute inflammation to eliminate chronic inflammation, do the extraction for the comedone, and proper intralesional injection of steroid in inflamed cyst. Let me show you how we are going to be extracting comedones and doing the injection. But keep in mind that really to eliminate chronic inflammation, we have to induce what we call acute inflammation for a good period of time, like about 5-6 weeks. The acute inflammation enhances skin ability to repair itself. Here is a wonderful little device that we use for extracting comedone. This is a comedone extractor. I take the pointed tip and poke the comedone. And I go aggressively into each comedone. Then with the correct, I scrape, with the other end, I scrape the trapped oil out. That's extraction. So what I do when patients come with acne, if they have a lot of comedone, I may bring them every week, every 2 weeks to do the extraction because each one of the comedone is a focal for immune response and a new cyst formation. When it comes to intralesional injection, we use triamcinolone acetonide. We have something called Kenalog in USA. I'm sure that it is also in different country. I diluted to 2.5 milligram in a syringe with bacteriostatic water, and I use the proper concentration in injecting all the cysts. Notice I penetrate to the center of the cyst, not below it, and inject. Go in and inject. So during the first few weeks of acne treatment, skin have nodules and cysts, really bring them in to extract comedone, do the injection. Once you do that, you will be able to clear acne at much faster rate without any damage to the texture. So in the O protocol, when you are using, you will notice that the steps you follow for acne or rosacea or seborrhea are just the same. Reduce sebum to maximum, renew the epidermis, repair the barrier function, attack the acne by extraction and injection, use a topical agent that creates acute inflammation to eliminate chronic inflammation. And you will have a tremendous response within a few months, 2 to 3 months at the most, in clearing the most difficult case of acne or cystic acne. Bring the patients in for extractions and injection frequently, especially the first month of the treatment, and attack. And by attacking the skin means help to renew the epidermis, help to clear the skin, and you can see within, like this patient here, within 10 weeks, I was able to give her a clear, healthy skin. Many of the patients who have excessive amount of immune response, strong immune response, excessive amount of oil production, can be helped also by using isotretinoin. Isotretinoin is a systemic treatment where I give it at a low dose, 20 milligram daily for a few months, or every other day, or twice a week, depends on skin tolerance and skin response. Simple rosacea, we treat it by eliminating sebum. Here we have more general immune response on the skin, not focal immune response as you see in acne. So we have to eliminate sebum, repair the barrier function. The O has rosatrol to eliminate redness, while we are using all the steps to fight and eliminate chronic inflammation. This condition used to be called, and still by many dermatologists, perioral dermatitis. It's really rosacea. You can see in this patient that skin is oily with large pores, damaged texture, and nodular eruption. Treatment is the same. Seborrheic dermatitis means seborrhea, just think of it like diarrhea of oil or sebum. So seborrhea means excessive oil production, creating what look like eczema. So the skin will be very sensitive, very irritated, eliminate sebum, repair barrier function, and you will be able to start really restore back very healthy texture. Now we move to cover pigmentation. Normally, when melanin is formed in the skin, it's distributed horizontally. That's what gives us nice, even color tone. The abnormality of pigmentation starts when you have wrong distribution, like few melanocytes in one area producing more melanin, let's say going toward the epidermis. That will create a spot on the surface of the epidermis. And if the pigment goes deeper in different direction, then that will create a deeper pigmentation problem, still will show through the epidermis. By reducing, the old treatment was mainly to reduce melanin. By reducing melanin alone, you don't solve the problem. You really have to restore the horizontal distribution. And that's why when I treat pigmentation, I recommend 2 steps. Bleaching using hydroquinone alone or mixed or non-hydroquinone, maybe twice a day, let's say. And once I see that I reduce the amount of melanin adequately, I stop the bleaching process. Don't forget, bleaching has to be followed by blending. And the blending is to restore that horizontal distribution. So bleaching, reducing amount of melanin, blending, restoring horizontal distribution. Pigmentation of the skin can be due to many things. Could be hormonal, could be genetic, could be due to chronic inflammation, irritation and injury to the skin, and so forth. Could be induced by the sun. So melasma is well known to everyone. It may come in different form, epidermal and dermal. PIH is after a skin injury, which is a temporary condition where they will have hyperpigmentation. And then you have varieties of changes, and sun can introduce a lot of pigmentation. Classic melasma. Again, what do the steps? GSR, renew the epidermis, address the melanocyte by bleaching and blending, reduce sebum if the skin is too oily. That will help to accelerate the response of melasma to your treatment. Reducing sebum can be using topical agent and can be also by isotretinoin for a short period of time. If you have deeper dermal pigmentation, you may need to do peels. Peels are usually unique for melasma, safer than using resurfacing with laser or pigment laser and so on. So you can clear melasma, no matter how bad it is, within 2 to 3 months by following the step. This patient tells you that she had melasma, but notice she also has rosacea. So in this you have to treat both conditions. So you treat rosacea as we discussed, you address the pigmentation as we discussed, and you may need isotretinoin in these patients, and you have to attack, meaning they have to go through a period of 5-6 weeks where they are red, dry, exfoliating. The more the better, nobody dies. And you can see when we do peels, could be to, let's say, controlled depth peel or superficial exfoliative peel like the ZO3 steps, we sometimes correct deeper pigmentation that does not respond only to topical PIH, active acne. You can address both when you are doing the treatment. Sun damage. Sun damage creates pigmentation, can create damaged DNA leading to skin cancer. So we can renew the epidermis. In ZO, we have many protocols done to correct sun damage and repair damaged DNA and eliminate chronic inflammation, plus the procedures, the peels that we use to enhance epidermal renewal, derm stimulation, and so forth. Freckles, other form of sun damage, you can see, you can eliminate it. And then after that, you can keep it away by using proper sunscreen and proper protocol to keep the epidermal renewal process. When we are talking about procedures, really we're not going to cover a million procedures. I'm sure that all of us are familiar with them. However, I'm going to talk about a few specific things. Before I do procedure, I recommend highly preparing the skin and getting the skin ready for the procedure by restoring normal cellular function, by enhancing skin ability to repair itself, by repairing the barrier function, restore natural hydration, and this can be done by using ZO protocol. After 5 to 6 weeks of preparing skin conditioning, I will be able to perform my procedure safely. Skin conditioning benefits are tremendous, and one of the important factors is that yes, it enhances healing, enhances epidermal renewal, enhances circulation, it restores natural hydration that will make your peel or laser procedure more even because water is a proper chromophore for peeling agents and for the laser wave. So you need to restore hydration, otherwise you will burn the skin and that can create potential complications. When it comes to peels, all of us are experts on doing certain type of peels. Traditionally, we use always lactic acid, mandelic acid, glycolic acid for peels, just their formula and so forth. But those peels are pure exfoliation. The benefits are limited and short-lived, doesn't last too long. Through the years of research, I came up with a more effective method of epidermal renewal and exfoliative peel by adding the element of stimulation. I added that the peel should stimulate skin. So, yes, you have to exfoliate skin, then you have to stimulate skin. So that's what really the objective of the three-step peel. The three-step peel can be repeated monthly for everything. There's almost no contraindication. I don't peel pregnant women. I don't attack with aggressive treatment pregnant women. However, three-step peel can be treated any condition. The good thing about the three-step peel is that you don't need to neutralize it. There is no timetable how long to leave it on the skin. The moment the acid interacts with the epidermal protein, it disintegrates the protein and create what look like a powder coat on the surface. That's exfoliation. Then we add a retinol as a second step. And the retinol is massaged thoroughly into the skin on top of the coat of the powder. And then we apply the hydrating anti-inflammatory creams. And you can see the powder on the left side, and you can see after we apply the retinol on top on the right. This man had a three-step peel done 3 times, once a month, plus using the O protocol for pigmentation. This woman with plasma and some damaged texture and a little bit of aging process. Also, she had 3-step peels, one peel every month, and plus ZO anti-aging program. Sometimes we may need a deeper peel that reaches the dermis for correcting pigmentation or deep damage or deep structural damage in the skin, such as scars, deep wrinkles, deep lines, and so forth. I call the process ZO controlled depth peel because I really can control the peel. You'll see how we control the peel. In certain cases where the damage even is more advanced, I may do a combined procedure where I do the peel first, followed by CO fractional laser. And we're going to discuss these two entities. The ZO controlled depth peel. This is a unique peel. I use TCA concentration from the range between 25 to 28%. I apply the TCA mixed with the blue base. The blue base act like a guide to ensure even application and to ensure that I did not skip any areas. The base that I mix it with TCA slows down TCA penetration. We apply the acid until we get a frost. The frost has variable thickness. The more you put acid in one area, the stronger the frost will be. Notice in this picture here, on the temple area, where it say PD. PD means papillary dermis. Papillary dermis means the acid reached the papillary dermis. The sign was, by pinching the skin, you see the wrinkles that appeared on the area where I reached the papillary dermis. And you can see through the frost the pink background. The pink background indicates there's a free blood flow still in the papillary dermis. So, epidermal sliding, when you pinch the skin, which is a sliding of the epidermis on the dermis, creating fine wrinkles, and the pink background, that's two depth sign indicating the papillary dermis. Now, if I applied more, look in the purple circle there, say IRD. Notice the wrinkles does not go there when I pinch the skin because the epidermis and the dermis now are compact. They are attached together by the coagulated protein. So there is no wrinkles. So we lose the epidermal sliding. And notice that also there's no pink background, meaning the blood flow now is completely wiped out in the papillary dermis. So the moment you lose the epidermal sliding and the pink disappear, stop. That's the end of the peel. That's what we call the IRD controlled depth peel, or PD controlled depth peel, or combined PD and IRD controlled depth peel. This is how we ensure safety and renewal of the skin. The controlled depth peel is ideal in tightening skin. So if I go to IRD all over the patient face here, you can see in 3-4 months later how much tighter the skin is. Ideal for deeper pigmentation. So if I do the IRD level peel on this patient here with definitely before and after ZO protocol treatment, you can see there's normal restoration of healthy color tone. For damaged texture and the laxity and even pigmentation, you can see the rejuvenated face. So that's why when we do procedures, we have to ensure that the procedure is done properly to the proper depth. The combined procedure is a novel procedure I created where I do the controlled depth peel first to the IRD or to the papillary dermis. And then I use the CO2 fractional laser on top. I don't have to do the whole face sometimes. I may do just local areas, or I may do the whole face. I focus on a certain area where I have more damaged texture, deeper scars, and changes that require deeper procedure in the skin. Here we have a patient before on the left side showing you the wrinkles, showing you the hard wrinkles in the upper lip area, the laxity, the damaged texture. So we did that controlled depth peel first and then followed that with what we call the fractional laser, where you see the red areas, the bloody areas. This procedure will heal within 8 days, 8 to 10 days. We have a wonderful healing kit in ZO that enhances the healing, prevent crusting, scabbing, oozing, and make the procedure, the healing procedure, effortless and quite safe. The benefit of doing these combination procedure, this combination or combined procedure, is deep structural damage. Here we have a gentleman who suffered from bad acne when he was a teenager, had acne scar, you can see the damaged texture, plus he is older, you see the wrinkles, you see the lines, and so this type of damage, peel alone or laser alone, may improve them to a degree. However, when I do the combined procedure, I follow the protocol. I condition him for 5-6 weeks minimum. And then I do the combined procedure. Then I put him back on the O protocol to enhance whatever renewal I need. I need to produce more collagen and elastin. I do the aggressive stimulation or the strong stimulation. I see that I need to address the rosacea. I put an element to address the rosacea. When I do all this, the transformation within about 4 or 5 months is remarkable. We can now almost restore natural, healthy skin to anyone. Remember what I said when I started the webinar. We need to renew the cloth. We need to renew the skin. Not play games with the skin surface or little areas here, little areas there by addressing the surface, using procedures that doesn't address the problem and address the surface only. Deep acne scars like this require same protocol. Activate skin, condition skin, renew the epidermis, build the barrier function, stimulate skin aggressively, address the sebaceous, the oiliness of the skin and the sebaceous glands, and see the transformation. In these patients who have already, they are prone to have sebaceous gland disorders, what I do is that I put them on isotretinoin after the procedure, not before the procedure. I can do 3-step peels on somebody taking isotretinoin, but I would not do the deep combined procedure on somebody on isotretinoin. I have to wait 3-4 months. And if the patient doesn't want to wait 3-4 months, we give him the isotretinoin after the procedure. Pigmentation problem can be addressed in the same protocol. This patient had ZO protocol to treat pigmentation. 6-8 weeks later, she had the controlled depth peel, and we can see that the results are really wonderful. If they have rosacea or sebaceous gland coexist with melasma. And don't forget, we have to treat any coexisting condition at the same time. Here we have patients who have severe sun damage, rosacea, telangiectasia, damaged texture. So to take the skin and make it healthy again, we have the definition, we have the protocols, we have the know-how, and we know that we have the procedure, we know that we can do the best for this patient. So within 3 to 5 months, here is a new skin, healthy skin. As you can see, it's smooth, even in color tone, is strong, is hydrated, and free of disease. For further information, I advise all of you who deal with the skin to adopt the new thinking about skin. Skin is a living organ, has functions. We have to address it based on function. Address the cells, don't address the surface. Renew the skin, don't focus on the problem. For those people who like, for example, like to do the combined procedures, like to do the controlled depth peel, like to advance their knowledge when it comes to skin, we do 2-3 times a year a training for many people who come in from all over the world, who are really for 2 days, and they can be educated and they are going to observe many of these procedures. My office in Beverly Hills, you are welcome to visit me anytime if you happen to be there. My other office in Laguna Beach, here I enjoy it so much because when I go on the balcony, I watch the people on the beach cooking themselves, so I know that we're going to have a unended limitation of patients. And also we have certain locations, ZO Skin Center, ZO Skin Health, in one of the area to do skin analysis, evaluation, and spread the knowledge about skin health. I enjoyed talking to you. I hope I will meet with you in the future, either in person or through seminars and more webinars.